Do you believe that living healthily after 60 depends solely on genetics or luck? What if I told you there are 4 affordable and effective vitamins that can completely change the course of your longevity? My name is Dr. William Tharnell. I'm a physician specializing in elderly health, with over 25 years of experience in geriatrics and integrative medicine. What I'm about to share with you is based on science, clinical experience, and hundreds of patients I've helped age with vitality, clarity, and independence. The human body has an impressive ability to regenerate, even after 60, 70, or even 80. But to do so, it needs the right nutrients, and that's exactly what we'll discuss today. In this video, you'll discover the 4 essential vitamins every older adult should take to live longer and better. And the best part? They're all inexpensive, safe, and easy to find. But pay attention. The last vitamin on the list is the most overlooked, yet the most powerful. You'll understand why it can be decisive in keeping your memory sharp, your heart strong, and even preventing serious diseases like Alzheimer's and heart attacks. So hit the like button, share this with someone you love, and subscribe to the channel, because taking care of your health is an act of love, both for yourself and those around you. And while you're at it, leave a comment telling us where you're watching from. It's always exciting to see how far this message reaches. Aging is a privilege, but it also brings challenges that many underestimate. As the years pass, our bodies become less efficient at absorbing nutrients, even when our diet seems adequate. The stomach produces less acid, the intestines become less efficient, and metabolism slows down. The result? Even with a good diet, many older adults develop silent deficiencies that affect memory, mood, bones, muscles, and even the heart. Additionally, lifestyle changes play a role: less sun exposure, reduced dietary variety, frequent medication use, and less physical activity. All of this increases the risk of chronic diseases, falls, constant fatigue, and loss of independence. But here's the good news: it doesn't have to be this way. With the right supplements, small routine changes, and reliable information, it's possible to maintain energy, focus, and strength well into your 90s or beyond. This isn't just theory. It's what science has proven in studies with older adults from various countries. Research shows, for example, that adequate levels of vitamins like D, B12, C, and magnesium are directly linked to a reduced risk of neurodegenerative diseases, infections, osteoporosis, and even cancer. This isn't about trends or exaggeration. It's about giving your body the bare minimum it needs to keep functioning well. As I often tell my patients, the body wants to live, it just needs a little help. And that's the help we're about to reveal, one by one, starting with vitamin number 1. Vitamin 1, Vitamin D, the invisible shield of longevity. Imagine a vitamin that acts like an invisible shield inside your body, protecting your bones, muscles, brain, and even your immune system. That's vitamin D. It's essential for calcium absorption, bone health, and fracture prevention. But it goes far beyond that. Studies show that vitamin D reduces the risk of dementia, depression, respiratory infections, and may even help prevent certain cancers. The problem? After 60, the skin's natural production of this vitamin, through sun exposure, plummets. And since many older adults spend more time indoors, deficiency is extremely common. In the US, it's estimated that over 60% of older adults have insufficient levels of this vitamin. Symptoms can be subtle: muscle weakness, bone pain, chronic fatigue, low immunity, and even frequent falls. Many of these signs are dismissed as normal aging, when in reality, they could just be a vitamin D deficiency. Natural sources are limited: fatty fish like salmon and tuna, egg yolks, sun-exposed mushrooms, and fortified foods. But generally, these aren't enough to reach optimal levels. That's why supplementation is highly recommended for older adults, always under medical supervision. Regular testing and dose adjustments are ideal. Taking vitamin D isn't a minor detail. It's an essential measure to prevent fractures, maintain muscle strength, and protect the brain and heart. Now, let's move on to vitamin number 2, one your brain is begging for right now. Vitamin 2, vitamin B12, the fuel for your mind and nerves. Few people realize this, but a silent vitamin B12 deficiency can be mistaken for Alzheimer's, depression, or even multiple sclerosis. Vitamin B12 is essential for brain function, red blood cell production, and nerve integrity. Without it, the body literally starts losing connection with itself. After 60, the stomach produces less hydrochloric acid, directly affecting B12 absorption from food. So even those who eat plenty of meat, eggs, and dairy may have critically low levels without knowing it. And the scariest part? Symptoms are often subtle or mistaken for natural aging. Do you experience tingling in your hands or feet? Memory loss? Extreme fatigue? Irritability? Brain fog? All of this could be due to low B12. In severe cases, deficiency can cause irreversible nerve damage, leading to loss of coordination, incontinence, and even dementia-like symptoms. Natural sources of B12 are animal-based, red meat, liver, fish, eggs, and milk. But since absorption declines with age, supplementation is almost always necessary for older adults. The good news? B12 is one of the cheapest and safest vitamins to supplement. It comes in tablets, sublingual capsules, or even injections for severe cases. In my clinical practice, I've seen dozens of cases where older adults seem to be shutting down, only to regain mental clarity, energy, and emotional stability simply by correcting their B12 levels. Never underestimate the impact of this vitamin. It's not just a detail, it's fuel for your brain, mood, and independence. And while B12 takes care of the mind, the next vitamin takes care of your entire defense system. Let's talk about vitamin number 3, a true shield against infections and premature aging. Vitamin 3, vitamin C, the guardian of immunity and cellular repair. When it comes to healthy aging, few vitamins are as well known, yet as underestimated, as vitamin C. It's famous for boosting immunity, but what many don't know is that vitamin C has much deeper, vital functions, especially in older age. It acts as a powerful antioxidant, neutralizing free radicals that cause premature aging, inflammation, and chronic disease. Additionally, vitamin C is involved in collagen production, essential for skin, joints, blood vessels, and wound healing. In short, it plays a role in nearly every cellular repair process in the body. And there's more. Studies show that adequate vitamin C levels are linked to a lower risk of cardiovascular disease, cataracts, bone fragility, and even cognitive decline. But here's the catch. The human body can't produce or store vitamin C. It must be consumed daily, and reserves deplete quickly, especially during stress, illness, or frequent medication use. Unfortunately, many older adults consume far less than they should. This happens due to reduced appetite, fewer fresh fruits in their diet, and digestive issues that impair absorption. Deficiency symptoms may include persistent fatigue, frequent colds, slow wound healing, gum bleeding, and joint pain. The best natural sources are citrus fruits like oranges, kiwis, and strawberries, as well as bell peppers, broccoli, and kale. But even with a good diet, supplementation is often necessary, especially for older adults with frequent infections or chronic illnesses. Supplementation is simple and affordable, with chewable, effervescent, or capsule options. Think of vitamin C as your body's guardian, present in every cell, protecting you from within every day. It's much more than cold prevention. It's a direct investment in your immunity, vitality, and regenerative capacity. And if we've covered protection, memory, and immunity so far, the next vitamin is responsible for something even more essential: the energy that keeps everything running. Vitamin 4, magnesium, the invisible conductor of the body. If you could take just one mineral that regulates your heart, relaxes muscles, improves sleep, relieves chronic pain, and even protects your brain, it would be magnesium. Though not technically a vitamin, magnesium is just as essential. It acts like an invisible conductor in your body, coordinating over 300 vital biochemical reactions. And for older adults, it becomes even more critical. Magnesium deficiency is extremely common in people over 60. This happens for several reasons: reduced intestinal absorption, chronic use of medications like diuretics and acid blockers, and fewer leafy greens and natural foods in the diet. The result? A body that starts malfunctioning in multiple ways at once. Symptoms include nighttime cramps, muscle stiffness, heart arrhythmias, insomnia, unexplained fatigue, anxiety, irritability, and even chronic constipation. Many patients describe an exhaustion that doesn't improve with rest, a kind of physical and mental burnout. And the most surprising part? Most never suspect it could simply be a magnesium deficiency. Large-scale studies show that low magnesium levels are linked to an increased risk of heart attack, hypertension, type 2 diabetes, osteoporosis, and cognitive decline. In short, we're talking about a true pillar of elderly health, ignored by many. Natural sources include dark leafy greens like spinach, kale, and broccoli, as well as nuts, seeds, avocados, and legumes. But unfortunately, modern diets, low in magnesium, and increasingly depleted soils make it nearly impossible to get enough from food alone. That's why supplementation is highly recommended for most older adults. Forms like magnesium citrate or glycinate are well absorbed and cause fewer side effects. Adding magnesium to your routine can mean less pain, better sleep, calmer emotions, and improved cardiovascular function. It's no exaggeration to say that magnesium is often the missing piece that helps the body function smoothly again. The power of simple choices. Over decades of treating older patients, I've learned one unfailing truth: bodies that get what they need last longer, work better, and suffer less. The 4 vitamins and minerals we've discussed, vitamin D, B12, C, and magnesium, aren't just pills. They're tools. Like replacement parts your body needs to keep running with safety, clarity, and strength. Many still believe that eating well or living stress-free is enough for health. But the reality is, after 60, the body changes. Absorption declines, deficiencies accumulate slowly, and symptoms appear when it's already hard to reverse. Waiting until you feel pain, fatigue, or memory loss to act is too late. Supplementation, when done responsibly, is a small investment with enormous returns. It's not about replacing medications, it's about preventing the need for them. Every year, millions of older adults are hospitalized due to falls, fractures, heart attacks, and infections, many of which could be prevented with something as simple as adequate vitamin D and magnesium levels. So don't neglect your health. Don't wait for a diagnosis to start caring for your body. Eating well is essential. But for those over 60, supplementing is an act of wisdom, self-care, and responsibility. Your body still wants to live. It just needs your help. Throughout my career, I've had the privilege of helping hundreds of older adults transform their health with simple adjustments and proper supplementation. I remember Margaret, a 74-year-old from North Carolina. She came to my office exhausted, with knee pain, no energy to climb stairs, and, as she put it, my memory seems to fade a little more each week. After simple tests, we found deficiencies in vitamin D, B12, and magnesium. We started supplementation, adjusted her diet, and encouraged light outdoor walks. In less than 3 months, Margaret returned smiling, saying, "Doctor, I'm walking in the park again. My daughter says my eyes look alive. I feel like myself again." Another memorable case was James, a 68-year-old former bus driver from Ohio. He struggled with insomnia, nighttime cramps, and constant anxiety. The diagnosis? Low magnesium and vitamin C. With guidance and discipline, James began sleeping better, managing stress, and, as he said, stopped waking up broken every day. These stories aren't exceptions. They prove that with the right nutrients, the body responds. The brain thanks you. Mood improves. Life reignites. No matter your age today, what matters is what you do next. At 65, 75, or even 85, there's always room to regain energy, clarity, and a zest for life, as long as you give your body what it needs. Have you heard of the blue zones? These are 5 regions worldwide where people live past 90 or even 100 with health, clarity, and independence. They include Okinawa, Japan; Sardinia, Italy; Icaria, Greece; Loma Linda, California; Nicoya, Costa Rica. What's striking isn't just their longevity, but their quality of life. Researchers studying these populations found common factors that anyone, anywhere, can adopt. Diets rich in vegetables, fruits, and whole grains. Constant movement, walking, gardening, daily tasks. Strong social connections and a sense of purpose. Low stress, with daily relaxation or spiritual practices. And crucially, high intake of essential vitamins and minerals, like magnesium, vitamin C, D, and B12. Even without calling it supplementation, these populations get what many modern diets lack, and their bodies function better, with fewer medications, hospitalizations, or early loss of independence. Replicating their lifestyle 100% may not always be possible, but adopting their core principles is entirely doable, even in big cities. You can prioritize fresh, colorful foods, walk outdoors daily, reconnect with loved ones, and most importantly, supplement what your routine can't provide. The blue zones aren't distant utopias. They're proof that healthy longevity is a matter of choice, discipline, and knowledge. And now you have that knowledge. The question is, what will you do with it? You deserve more than just aging. You deserve to live with energy. To wake up pain-free, with mental clarity, good humor, and the drive to enjoy the life you've worked so hard to build. Don't accept that aging equals decline. That's a myth. True healthy aging is quiet, steady, and full of small daily victories. It's not about living longer at any cost. It's about living well for as long as you have. Playing with grandchildren, making your own choices, walking without fear of falling, remembering important dates, keeping your stories, conversations, and freedom. This doesn't come from magic formulas. It comes from simple, powerful actions, like supplementing the vitamins and minerals your body desperately needs. From caring for yourself consciously, not out of vanity, but out of love for life. Remember, no one can live this life for you. No one feels what you feel in your body, except you. So respect your body's signals. Listen to what it's trying to tell you. And don't ignore what could be changed with simple decisions. You still have so much ahead. And even if time feels short, you can still have quality. More laughter. More clarity. More independence. More peace. You deserve all of that. And more. If you've made it this far, you've already taken the first step. You've chosen knowledge. You've chosen to care. Now, the most important question is, what will you do with this information? Most people ignore their body's signals. They wait for a diagnosis before changing. But you don't have to wait. You can start today. With small steps. One supplement at a time. One walk. One glass of water. One commitment to your health. Remember, longevity isn't a privilege for the few. It's a right for those who take care of themselves. And you deserve that care. Share this video with someone you love. Leave a like. It helps us reach more people. And comment below, where are you watching from? Let's build a conscious, mature community committed to well-being. If you haven't subscribed yet, do it now. Here, you'll always find reliable, human-centered content, made for those who understand that caring for health is caring for life itself. Until the next video. And remember, you're never too old to start again. You're right on time to prioritize yourself.